Hornbill TV te Dr. Bello Clinic aro Children's Hospital Dimapur ahine se aji yare ahine thaga nishna Dr. Bello Clinic khan pra yare Nova IVF Guwahati khan logore tie up kuri kine aji yare free IVF camp kore manuhan kun IVF lagi ase tai khan ke free consultation dia laga ekta program de man aise tahan itia bi jai ase jai thakya nishna yare IVF laga specialist pra holi bi ahi gene kotha kuri gene ja bishi insightful kotha kuri gene ja ro yare do bishi easy hoi jawle manu bishi bi travel kuri gene Guwahati ja treatment sob karne bi IVF kurala treatment Guwahati jawo lagi jai holi bi itia holi re Dr. T Bello Clinic aro Children's Hospital de tai khan ahi gena first tare jai gena ki kurule ase tade kuri digine yare ahi gene hi tai khan full treatment do Dimapur pra hi itia do kuriwo pariwo koi gene ekta bhal khobor ani ase one itia ide tai khan bra press conference ekta hold kurala details saw
Nova IVF also here. We are happy to partner with them in Dimapur. Across India, there are many Nova IVFs now, even in Southeast Asia. And with great success, they have already attained 1 lakh deliveries with Nova IVF so far. And it is in collaboration with Nova IVF of Spain. And we are happy to collaborate, partner with Nova IVF in Dimapur.
Let me make a few quick points for the viewers that I am born and brought up in Dimapur. I did my schooling in Holy Cross School, and way back in 1982 I passed from Holy Cross, and then I was away studying for my medical courses and other things. I was in USA to do my fellowship in the year 2002, and then in UK for further studies. So today is a very important day for us because we are starting IUI clinic here in collaboration with Dr. Bello's Clinic and Children's Hospital. I am associated with this hospital owner, Dr. Bello, who is the senior Bello, and you will be happy to know that he was one of the pioneer of obstetrician and gynecologist of Nagaland. And I had the honor of working with him for a few months way back in 1992 in his old nursing home in the main city. So I learned a lot from him before I started my journey for my further post-graduation and all. So I had the pleasure of working with him. Now I have the pleasure of working with the second generation, his daughter, Masasino Bello. And hopefully I'll be continuing my association with them for the third generation as well. Hopefully one of her daughters become doctor and carries on with her legacy forward. Having said this, let me give you a quick recap of the problem of infertility in our society. We had done a statistical data analysis of the incidence of infertility in Northeast India, and we found that 1 in 6 couples will face difficulty in getting a baby after they get married and having regular intercourse for 1 year. So this incidence is on the rise. So we exactly do not know what precisely is the reason of increasing infertility and childlessness. We did a few research and found that 50% of the cases of infertility lies with the male partner. Earlier though, we used to think that the whole blame we used to put on the female partner. But now with modern technology and testing, we found that 50% of the cause of infertility lies with the husband and 50% with the female. Similarly, lifestyle changes have occurred of late. Increased use of smoking, drugs, and other substance abuse plays a very important role in declining fertility rates. We are living in an era where people get married late. This is one of the prime reason of infertility rates increasing, especially in case of women. Nowadays, women get married at later ages. They don't want to become mother very soon. They postpone their first child for a few more years. And by the time they reach 40 or 42 years of age, and when they plan to become a mother, their ovarian reserve decreases and it becomes very difficult to conceive naturally. So this tie-up with Dr. Belho's Hospital and Children's Clinic and Children's Hospital is aimed at looking after the childless couples of Nagaland as such, where they find it very difficult to go to Guwahati and other higher centers because of logistics and the travel and the finances involved in staying there in Guwahati, plus the language barrier that happens in many cases. So we have decided that we will set up this IUI clinic here, and then we will give the treatment to the deserving couples. So IUI is a treatment where we take the sperm of the husband and we wash it and then put it inside the mother's womb. And then after the pregnancy takes place, she will be looked after by the staff of Dr. Masasino Belho and herself. She need not travel to Guwahati. The entire apparatus for doing an IUI, state-of-the-art apparatus, are already here in this hospital. So our main aim, which is our motto, is to do our job transparently and at an affordable cost, because most of the patients of our region are not well off to spend a lot of money. So we will be doing the treatment at the least possible cost so that it benefits all sections of the society. Simultaneously, we will also be starting IVF in the future. We have a plan of doing this, and right now part of the IVF will be done here, especially the stimulation part, so that the patient's stay in Guwahati reduces considerably. Look, IUI is a very simple procedure where we take the sperm of the husband, we wash it in a special media, we have a special device to wash the sperm, clean the sperm, and then inject it inside the mother's womb. So these cases we try in patients whose fallopian tubes are normal and who are not very elderly. So usually it works very good in women of younger age group, especially below 35 years of age, and whose husbands have reasonably good sperm parameters. So normally we usually try for 2 to 3 cycles of IUI before we consider it to be a failure and then refer it for IVF future. But if the patient is more than 35 years of age, we don't waste much time in doing IUI and wasting her time. We do 1 or 2 cycles and immediately refer the patient for IVF. And most of the people have a myth that children born through IUI or IVF may have some birth defect or something like that. So let me give you a brief history of IVF. The first baby of IVF was born in 1978 in London. So it's almost 40 plus years. Till now, all the statistics and data have shown that there is no increased incidence of abnormal birth or increased rate of congenital anomalies in children born through IUI or IVF. This is settled once and for all. Rather, it was found that babies born through IVF are healthy, they are more intelligent, because the sperm that we select to do the IVF and the eggs that we retrieve from the mother's womb are of very good quality. So the resulting embryo is also very good. Sometimes in families where there are history of a congenital anomaly, like in family they have earlier children having some diseases, if we do IVF, then we can select the embryo. We can test the embryo before implanting it in the mother's womb, whether this embryo is also carrying that congenital anomaly or not. If the embryo is carrying that disease, we will discard it. We will not implant it. We will only implant those embryos which are good and which are genetically right to be implanted, so that the baby is healthy and doesn't carry the congenital anomaly that runs in the family.
So again, last question from my end. This question is for Dr. Bello. Since on a larger perspective, what we hear is that like IVF is an expensive affairs. So like in your hospital, you have already stated that like it is going to be affordable for the couples, for the citizen. So does it covers under any government schemes where citizens can take advantage of that?
And
Also,
Nagaland
or is
government
it only
does
like a private?
In the last conversation with the minister, the health minister, about a year ago, I had also put this point across that if Ayushman or CMHIS can cover IUI and IVF, so they are still in the process of accepting this one. We are not certain yet. They have not informed, and I don't know whether it is still, we will follow through with that, but whether it is implemented is yet to be known. But otherwise, as of CMHIS and Ayushman, we are hoping that at least 2 cycles can be covered. I had requested for 3 cycles of IUI and 2 cycles of IVF. So that will help our people. But we are still not sure whether that can be implemented, but it's in the discussion.
Can I add a few lines? We get a lot of patients from Nagaland who are state government employees, and the state government reimburses a lot of the money that is spent on it, especially the medication and few procedures like ovum pickup and all. So I think 60 to 70% of the cost involved is being reimbursed by the government, provided they submit all the authentic documents.
So they have their own formats. They share a format with us. We fill in the details of all the bills, all the quantities of the medicines that are being used, all the procedures that are done. We self-attest it and we hand it over to the patient so that they can submit it to the insurer and they can get the claim back.
So another thing is that on an average, an IUI is costing somewhere 20,000 rupees per cycle. So we are bringing it down below 10,000 rupees per cycle.
Yes.
So which is actually a reduction compared to 20,000. And in terms of IVF, many centers are charging somewhere between 3 to 5 lakhs. So we begin with 1.3 lakh per cycle. So I feel that that is affordable when we compare it to the larger amount.
Yes.
Now, sir, how about the chances risk for the mother as well
Risk for the
regarding this idea?
regarding
You
IVF.
have just justified about the child. but
Yes.
how about for the mother?
Okay. Nowadays, IVF has become absolutely safe because we have improved injection protocols. Earlier, the injections used to produce some reactions in the mother, like ovarian hyperstimulation syndrome. These are absolutely zero now because the kind of stimulation protocol that we use, which is an antagonist protocol, is absolutely safe for the mother. Since last 5 or 6 years, we have never got a single case of ovarian hyperstimulation syndrome till now. पहिला तो पेशेंट्स खान गुवाहाटीते जाले IVF निमित्ते तो 2 months 3 months भी থাকিব লাগে आजिकाली आमी खान की करिब डॉक्टर मसासिनो बेलो लगते फर्स्ट कंसल्ट करिब 5 days work of pre IVF thing will be done here. They will go to Guwahati te jai kina 1 week aro thakibo, only 1 week, and we will take their eggs and the husband's sperm, and then after 1 week we will send them to her. Aro pichete, when we make the embryo, in the next month we will call them for another 1 week. Tate jai kina 1 week thakibo, embryo to umte halibo, ako yate ahi jabo. Ahi kina remaining period of the pregnancy will be looked after by Dr. Masasino Bello. So the earlier concept that Guwahati te jai kina shi maina thakibo lagibo follow up nimite itu to nohoy. So two visits to Guwahati. First visit 7 to 10 days, second visit 7 to 10 days, and the remaining workup will be done by Dr. Masasino Bello. Now you take over.
Yeah, ma'am, तो तभी वो free IVF came to Ajil विषय response की निगाह थी किसी.
Ajila response to bishi bhal thakise amikhan sir aro tahanla team bi para tak to simplified language para tahan logor kotha koise iniga IUI hobi IVF hobi itu to bishi scientific dangor kotha language cholai gina koile to patient manu na punje para tak to amikhan bi nijor la nagamis para bujai dibole kore Ajila response to we had how many patients?
We had around 20 patients.
20 টা patient nishina aji saishe Aro last IVF laga amikhan it to be more than 20 patients ashe. Awareness thaki kina ahishe kole to amikhan sai dibo for sure. And amikhan bi jiniga manukhan moikhan laga community la economy bi bujigina samji bujigina kiniga madad dibo pare itu dil de ase amikhan laga. The main thing is ki kurile khorcha bi komti kuribo aru ja aha duk suk khan komti kuribo itu first ase. But first aru second to para tak to iniga ekta family de bacha lobole mon jai ase kole to bishi deri rukhi gina sal rukhi gina nijor para hobole la rukhi thaka nokuri gina at least iniga para bi madad pabole khan early care seek kuile bal hoboni ki itu koi ase.
Yes, there are few contraindications of doing IVF, but these are very rare. For example, the government of India have said that patients with severe heart disease or kidney disease or patients who are suffering from cancer and all those things, and if they want to become mother, it's better not to implant the womb in them. We can take a surrogate mother. Itu bi koribo pare. We can take the husband's sperm and the mother's egg, but instead of implanting the embryo in her womb, we can implant it in a third party. Surrogate mother ekta hui jabo, taike embryo to tate halibo, aru bacha to carry koribo 9 months pichete delivery hua pichete to ako biological parents ke to di dibo. Itu bi ase. Aru ajikali medical science to iman advance hoise. Ito patient laga diabetes thakile bi, thyroid thakile bi, aru haru kiba disease thakile bi, medical to iman develop hoise during pregnancy. Ami khan to ito bhal pora control koribo pare.
IVF kwa to sob age group karne nohoy para tak to 50 years below karne hi ase. IVF is for women below 50 years. Aru parile to IUI to below 40 years hole bhal hobo.
Result to bhal hoy.
Result bal hobole karne itu karne apuni 60 years hoy kina IVF koribole to na bhabibi de.
So just one last question from my end. What is the success rate of Nova IVF so far?
Yes, so I was expecting this question. Nova IVF is very transparent. So recently we had a comparative study through an independent agency. There are not so many IVF centers now in the country, and we are the topper. On an average, keeping into view women of 40 years of age and women of 25 years of age, because we get people of different age groups. But on an average, we are maintaining around 70% success rate. But if the patient's age is less, and if other things are good, the success rate rises to around 90%. Failure in fertilization is almost nil in Nova. For the last 5 years of study that we have found that fertilization rate was around 98 to 99%. Ito sperm aro egg meet korea embryo baneato. The failure occurs after the embryo is put inside the mother's womb. Miscarriages happen. So that depends little bit on luck, little bit on other factors, how the patients follow up, whether they are following up our directions or not, what kind of lifestyle they lead, and few other things as well. But failure in the lab is almost 1 or 2%.
Itia karne man hobo ahya din khande mohan inega updates kana ni thagibo ke krisinyo ke ho camera person wong Hornbill TV Dimapur.